Good morning. My name is Jocelyn Roque. I am a medicine and surgery student, and today I will present a clinical analysis based on the BJM report on non-small cell lung carcinoma. The patient we will analyze presented with a fever of unknown origin. For this analysis, I will be using the SOAP methodology that will help me structure my presentation. This case presents a 70-year-old patient who comes to the clinic with a persistent fever. As an introduction, it is important to remember that a fever of unknown origin is a common challenge in family medicine. Initially, it may be thought to be an infection, but according to statistics, up to 25% of patients may have an underlying neoplastic condition that must be identified promptly to prevent complications. In the subjective section of our SOAP methodology, we present a 70-year-old female patient who comes to the clinic with a 2-month history of myalgia, diarrhea, and low-grade fevers. Her medical history includes breast and endometrial cancer survivorship, and she has a history of smoking more than 55 packs of cigarettes per year. This patient reports progressive dyspnea and a weight loss of almost 4 kilograms, which begins to point us towards a chronic and systemic progress. In the objective evaluation, the labs showed elevated leukocytosis and ferritin, which is a marker of severe inflammation. However, the key findings for imaging as seen in the chest CT scan was the identification of a massive 8.5 cm mediastinal mass with hilarial lymphadenopathy and moderate pleural effusion. This completely changed the diagnostic approach. The assessment ruled out endocarditis and infections. The biopsy confirmed stage 4 non-small cell lung carcinoma. The treatment plan included placement of a PleurX catheter for the infusion. Chemotherapy and immunotherapy were also initiated. Unfortunately, the outcome indicates that the patient experienced recurrent infectious complications and died 4 months after the diagnosis. We can conclude that when a fever of unknown origin presents at the primary care level, the patient's history and elevated inflammatory markers should be analyzed to determine if it is a chronic and systemic process, and to identify it promptly, since early imaging can make a significant difference in the prognosis. Here are the references that I used for this presentation. Thank you very much for your attention.